Hi, my name is Bob Brooks, host of the Prudent Money Radio Show. As you can imagine, I get a lot of questions about Obamacare. What's it all mean? I think there's a lot of confusion. So what I wanted to do today was address this in a video message to you to try to clear up some of this confusion. The good news is that this is actually not that difficult to understand. The problem is that the messaging of how all this works, I think, was caused the confusion. So what I wanted to do was address the top 6 questions that I get and go over some of the answers. The first one is, what is this exchange, this insurance exchange, and what does it mean? What do you do with this? Well, an insurance exchange, also called a marketplace, is where a consumer goes to purchase insurance. And there's certain insurance companies that participate on this exchange. If you live in the state of Texas, there's only 2 insurance companies that participate. That's Cigna and Blue Cross Blue Shield. Now, here's the thing about the exchange. You only buy insurance on this exchange if you are trying to get the subsidy. Now, if you qualify for the subsidy, and you do this through a basis of your annual income and family size, if you qualify for it, that means the government's going to pay part of your insurance. Now, that's the only reason why you want to go on the exchange. Other than that, if you're just getting individual insurance, you go to outside insurance companies. There's a lot of them, and you can take advantage of that and avoid the exchange if you need to. Second, how does this apply to me? Well, I take it and divide it up into 3 groups of people. First, there's people who are covered by their employer-based insurance plans. There's people who have individual policies. And third, there's those who have pre-existing conditions that might be on state plans or just have minimal insurance coverage. Let's start with group insurance. The problem that a lot of employers are facing is rising insurance costs, because with Obamacare, that's what's going to happen. Insurance costs are going to go up, premiums are going to go up, and that's going to be passed down to the consumer and to the small business owner. So what ends up happening, a lot of employers that keep their plans, they're passing that cost on to their employees. So if you are in that group and you feel like you're paying a lot of money for health insurance, go out and price in the marketplace and see what it would cost if you went off your group plan and went on into an individual plan. There's 2 ways of doing that. There's looking at prices today before January 1st, 2014, and then prices after January 1st, 2014. And there's a big difference because it's pre-Obamacare and then it's post-Obamacare, and the post-Obamacare insurance policy is going to be a lot more expensive. There's one other thing you need to know is that if you want to go and price insurance before January 1st of next year, then you have to look at and make sure that you don't have any pre-existing conditions, because you still have to qualify. After January 1st with the Affordable Care Act or Obamacare, you qualify no matter what. There's no mandates. And the second is the person with current individual insurance. Now, if you're that person, make sure that you go out and price with other companies and make sure that you have the best price. Now, if you already have your insurance in place and you know that it renews sometimes next year, you got to remember, once it renews, that price is going to dramatically go up. So it makes sense to go and see if you could get a new policy in December and hold that for at least 12 months before your prices go up. That's one way you can save money. So it's good just to go out and check that option. And then there's the person with pre-existing conditions. You're on a state plan, you may not have insurance. As of January 1st, you're covered. There is no pre-existing conditions. Is my insurance going to be canceled? I think this is one of the most blown up stories in the media, and I think that they're causing a lot of fear and a lot of confusion. If you consider the word cancel, that means that your insurance is going away for good. That's not what is happening. What insurance companies are doing, they're saying, you know what, we're going to terminate your current coverage and give you a new policy that meets all the mandates of Obamacare. And so that's going to be more expensive, but they can't take your current policy past January 1st because it doesn't meet Obamacare. Now, as you've read in the media, a lot of insurance companies did cancel these plans, but now President Obama said, you know what, you can keep it for the next 12 months. And so they've been able to reinstate those plans and keep the lower price. The next question, if my policy has been canceled, what steps do I take? Well, check with your insurance company, because you might be able to get it reinstated for the next 12 months. And also, once again, as I said earlier, Double check your prices. Make sure that you're getting the lowest cost of insurance, and you got to do that before the January 1st start of Obamacare. What if I have pre-existing conditions? Will I get insurance? And this is something that I think, once again, the media is kind of blown out of proportion when it comes to these canceled plans, is that starting January 1st, no matter what kind of sickness you have, you are covered. They cannot deny you. In fact, they don't even ask any health questions. They ask height and weight, and they ask whether you're a smoker or not, and that's it, and you qualify for the plan. I think the key to surviving universal health care is information and understanding what your options are so that you can always manage the cost. Because, like it or not, this is going into effect. It's going to be run by the government. It's going to be expensive. And you want to make sure that you're conserving your money and getting the best cost possible. If you want more information, if you need resources, you can go to prudentmoney.com. We have all kinds of resources set up. Just send me an email to Ask Bob, tell me about your situation, and I'll make sure you're getting the best information, the best resources, and get the best policy for you. That's it, prudentmoney.com.